Thanks so much for joining us. My name is Elizabeth Parks. I'm the President and Chief Marketing Officer of Parks Associates, and I'm so excited today to be joined by Kian Sanai from Independa, who is going to be sharing a little bit more about the role of the television as it relates to healthcare in our future. So Kian, thank you so much for your continued support of our Connected Health Summit and the research work that Parks Associates does. Let's go ahead and see if you can give us a brief introduction of Independa and tell us a little bit about this new partnership that you all have with LG.
You bet. Elizabeth, it's great to be with you and to be with Parks Associates all these years. As I've mentioned to you many times, you guys have called the consumerization of healthcare opportunity and market from very early on. So we've been in the same space and growing in the same space. And I think the rest of the world is caught up. So thank you for all that you do and the teams do in that space. With respect to Independa, what we have is we have a platform that allows really any individual to thrive at the residence of their choice. And that could be in their own home, or it could be in a senior living community. It could even be a short-term rehab or frankly a hospital. And to stay at the current stage of care longer, safer, and more comfortably, and even maybe certainly delay, if not eliminate, the next episode or stage of care. So that's saying a lot, but basically what we do is help particularly older adults, but as we'll chat today, overall anyone to have a very simplified use of the TV to bring an ecosystem of healthy offerings to the home in ways that are easily consumable and integrated with lots of different benefits and offerings all in one place.
Okay, so let's break that down a little bit and make sure we understand what exactly is happening for the consumer. So they're sitting on their couch and they are able to leverage the television and get direct access through an app. Is that how it works?
That is, and really the power of the model that we have with LG, and credit to them for this, is that they've integrated our platform inside their WebOS technology and platform. So, and that's across all their consumer brands, and it's a global agreement. So what that means is you can interrupt and put a notification up regardless of the channel that the person is in, regardless of the application that they're running, regardless of the HDMI that they're in. Maybe they're playing Roku, maybe they're playing a DVD player, if anyone still does that, but maybe they're playing a game console, maybe it's Fire Stick TV, whatever. And so the TV as a central hub still can notify you that a doctor's visit is coming up, or your Uber has arrived, your Lyft has arrived, or your medication time is up, etc., or any kind of notification, which is really helpful in helping folks stay where they are and staying independent.
Well, and we certainly have a lot of research that backs up the idea that consumers want to stay in their homes and that they are willing and ready to leverage technology to ensure that they are safe and also have the various communication tools. So tell me, I love the reference to that central hub in the home and the television, and we are tracking 56% of internet households now across the US have a smart television. So tell me why you think the TV is playing such an important role, especially for older consumers.
You bet. So it's almost too obvious, but let's go over some of the reasons. One is the familiarity with the device and with the format. So, older adults are more comfortable with the TV than, let's say, a very small screen. Some of it is physical. So we have eyesight issues over time, and you might need glasses that you otherwise may not need for the TV. The position of consuming the content is very different. Your head could be in a relaxed position. Your body could be relaxed versus, bringing your arms close, or using a keyboard for a computer, or using gestures for a tablet. So right off the bat, there's a few reasons. One is the size of the screen. The other one is the convenience of the consumption. Third one is familiarity and comfort for that device. Also, just demographically, naturally, the younger generation, the millennials, some of them don't even buy TVs. So essentially, we over-index on older adults anyway. But if you can go to the device that everyone knows how to use, is comfortable using, and turn that from a commodity appliance into a bi-directional engagement window to the world with clinical as well as social engagement benefits, as well as value around content being delivered that helps you educate your loved one or your, let's say, patient, customer, client, participant, care recipient, etc. So there's all these reasons, and I'll mention this health analogy for the TV. As we all know, it's now 80% of our cost in healthcare is in chronic condition management. And we all know that issue is highly over-indexed and represented by aging older adults. And we also know that even before COVID, social isolation that leads to loneliness, that leads to literally clinical depression, drives self-neglect, drives medication neglect, and drives recidivism and costs and anguish into the system. So when you sort of follow the breadcrumbs that way, the question is, guess what someone who is lonely and isolated and probably on chronic conditions, and even if they're not, what are they doing all day? Yeah, they're in front of their TV. And that's not because they have nothing better to do, it's because they don't have human interactions. You and I and people listening to this clip have never experienced not having human interactions for days on end, weeks on end sometimes. And so this is an epidemic that we've had before COVID, and now it's even worse. So if someone's using the TV, why not turn it into a way that we can actually help in a dignified way, without patronizing, without big brotherish features, to help them with their health and with their social engagement.
And let me ask, are you planning additional services like maybe exercise classes or wellness or other ways that consumers could interact? Can you maybe share a little bit more about that?
Sure. So, as you know, our traditional market this coming month, in a few days, actually, we're going to be 13 years old, and depending on how old this video gets, that seems really old in the space. And we're excited because the market has really come to us in a number of ways. So we started on the B2B side, and we're still very strong with our award-winning platform there, delivering in senior living, delivering in hospital patient education, delivering in home care, and the various segments of each one. PACE programs, for instance, short-term rehab, assisted living, et cetera. We have home care organizations that use us for dementia patients in their own home. So there's lots of flexibility and value to delivering content and engagement on a subscription base with our platform. By the way, you don't have to have an LG TV. So I'll hold up our Any TV Companion, which you've seen before, HDMI in, HDMI out, USB port, camera goes on top of the TV, and you end up being able to deliver content and do everything I mentioned with any TV. It's literally called the Any TV Companion. Now, fast forward to this past January with our major announcement with LG, we changed our business model to say the social engagement features of Independa, we're going to give away for free. So you can send a picture, you can send a message, you can even send a PDF file if you want for documents and compliance if you'd like. You can do video chat, inbound, outbound. With each one of those, you could see when somebody has seen your message, as well as you could see how they reacted. So they have emojis that they can respond with. All of that we're including for free, as well as including from Capital RX, wonderful pharmacy discount card that you can get up to 90% off your pharmacy. We also include free content for older adults. So Saltbox TV that allows you to watch old movies and syndicated shows, Mary Tyler Moore Show, Dick Van Dyke Show, and Lucia Ball, all those for free. So all that free content is there, so you can then engage with the half a dozen partners that we introduced as part of our launch around telemedicine. So you have 24/7 doctor coverage in 50 states. Same thing with dental coverage with dentists, with Dentulu. You have a whole bunch of content, WebMD through their wellness network. You have close to 800 videos that you have in 15 categories. First time ever, WebMD's exposed medical grade content to the consumer. So you can get on a very cost-effective subscription. And if you're having a surgery, or if you're thinking about surgery, your friend is, or you're recovering, or you have a question, or you're just curious, fantastic content that you don't have to go search the internet and get opposing views and so forth, and always being refreshed. We have from Spiral 100 exercise videos. So you touched on that. So for older adults, how wonderful is it to be able to exercise in front of a big screen TV versus trying to do that on a tablet or a phone? So we're really excited about that. Again, all their content's available for a subscription of $4.95 a month, and you get hundreds of videos.
Love how you are bringing all of these new applications to the television, focusing in on some of the older populations. But certainly, I'm sure you've noted as well that the value of technology since the pandemic for consumers has just grown exponentially. There's so many instances that we could say for ourselves and for others where broadband and connectivity just play such a critical role in our day-to-day operations as consumers. What's your plans for the future of moving, beyond just older populations and bringing these kinds of applications to, any age in the home?
Sure, you bet. So everything that I just talked about is not age specific. Some of it might be more advantageous to be on this big screen, but some of the things that are coming up is mental health on the TV, physical therapy. I've had, surgeries on my actually left leg where I was recovering with physical therapy. I can do that on the TV now. So that's one. The other one is we have home tests. So instead of schlepping out and standing in line and filling out forms, et cetera, you could do all that right on your TV and have the kit come to you. We're adding a lot more content. So we have therapeutic music, we have spiritual videos, we have educational videos that we're adding, and we're also adding virtual care. So you can basically have caregiving virtually right on the TV. And so we want to fill out all the telehealth components, so telemedicine, teledentistry. Another one that's really important that we're adding, which has nothing to do with age, is getting your pet covered through telehealth. So 80% of us have pets, and in so many cases, it's much more convenient to not have to take the cage in, or not have to, take the cat in if she's not interested to go, and, if the weather's not good, et cetera. Or if you have a, 2 a.m. on a Saturday tooth chip, you get a dentist and you can get a guidance on that and get prescriptions and so forth. So we want to fill out telehealth. We want to fill out video content. And then we want to add a whole bunch of free content that, again, has nothing to do with age. For instance, an AI-based quick survey that helps you understand how your pet's doing. And if you need help, you can go to a vet. And a bunch of others, hearing aid tests for hearing aids. And then last but not least is getting transportation, food delivery, and very importantly, e-commerce. So what are the few things that I can buy right on the TV that help me, again, if I don't go to Amazon all day long, and if I'm not as comfortable with the computer interface?
Well, that's awesome. I mean, you all are truly bringing it all home with this new platform, and it's really exciting to see, all that you have announced this year, and look forward to watching what happens in the next few months. Certainly agree that the television is playing a prominent place for consumers at home, and really what you're doing makes a lot of sense. And so appreciate all of your time today, appreciate your continued support, and look forward to seeing you in person soon. Thank you, Keon.
Thanks so much, Elizabeth. And one last thing, games, I forgot to mention, it has to be fun. So we're adding a whole bunch of games free of charge as well. It's wonderful being with you, and thank you for all that you do for our industry, and we'll talk later. It's a pleasure.